Even till today, after 1 year of investigation, after multiple probing, husband ने टेस्ट कराया, नहीं नहीं अभी उनको टाइम नहीं मिला. तो I said, अच्छा, okay. It's a very
But
common thing.
but the etiology of the infertility could be from the man's side as well.
Yes. So, in fact, it is said that 40% the cause is a female infertility, 40% male infertility, 40%, 10% both, 10% no cause found, idiopathic infertility. So, men are an equal culprit when it comes to producing a
Sometimes more.
baby.
So for men, it's the sperm count.
Yeah, sperm count, the motility of the sperms, and also the appearance of the sperm, the morphology of the sperms. Many times the sperm could be having multiple defects at the head, tail. So when we do a semen analysis, there are properly defined WHO parameters. So when we issue a semen analysis report, all this is taken out. Of course, nowadays we have more advanced tests. There's something known as DFI, DNA fragmentation index. So higher the DFI goes, that means the more is the damage which is happening to the sperms.
Wow.
Smoking is a big
Smoking is a big
culprit.
thing.
Big,
Exactly.
big culprit.
Smoking in women as well.
Absolutely. Smoking is one of the major reasons for the premature ovarian insufficiency. Major reason. And that's another problem today. I mean, it's
In your practice, are you seeing women smoking?
a lot.
A lot.
A lot.
That's not the case before.
It was not the case before. But today, a lot of people do a lot of things to look and feel cool.
Huh. Is it vaping or smoking?
Both.
Both.
It's actually very sad. Alcohol, we still understand. I still can't understand the psychology of a person who's smoking. What is it which gives you a high, knowing fully well that smoking affects every cell in the body, every cell in the body, top to bottom.
So I tell my patient is that, if you want to quit smoking or alcohol, if you want to quit only one, quit smoking.
Yes, absolutely. Smoking has a direct, I mean, it causes such a high free radical
damage. Yes, of course. And smoking decreases the sperm count and motility as well.
100%. Like, no doubt on this.
Yeah, and then ED, erectile dysfunction, is one of the most common side effects of smoking.
Yeah. I mean, again, people don't talk about ED. I mean, it's such a common problem. I mean, we investigate, kahin pe we don't find any cause, and then little bit, somebody says, oh, this is a problem. And then you go in a different direction.
But that should be the first thing.
That should be the first thing. But people don't talk about this. So, I'm happy, at least with the internet coming in, your platform, my platform. We encourage people to talk about, let's be open. I mean, there's nothing wrong.
Nothing wrong with it at all.
Nothing wrong.
Any infertility discussion should be both husband and wife.
Absolutely. But people don't come to us.
They don't come to you?
It's so strange, Dr. Paul. Just 2 days back, yesterday. So I was asking, I had 3 people in my OPD. Husband, wife, and the mother-in-law, the sasuma, right? And then, my standard question
Mother-in-law
is...
of the husband?
No, the husband's mom.
Husband's mom,
right?
yeah.
So my standard question, I take a detailed history and I ask, does any one of you smoke? Then immediately the mother-in-law pops in, oh, my son smokes, he has a lot of pressure and stress in his life. He works in IT, doctor, I hope you understand. I said, oh my God. I mean, this is like, as if the mother's trying to justify why does my son smokes. Now just think of the psychology. And I said, Mom, at least on this, you should not be taking your son's side. And you're trying to justify. I mean, you don't even know what kind of stress do as we work as doctors. Your son works in an IT department. You're saying, oh, he has a lot of stress. And that's why he smokes.
Wow.
So we have multiple types of problems when it comes to us as doctors.
You would see so many things, right? So many things. I remember when I was in OBGYN rotation, when we're dealing with the infertility, the family invariably creates a victim card for the women.
Yeah.
Is that still happening? Or?
See here, in case, just think of it, Dr. Pal, in case the woman said, I'm smoking, what response would a sasu mama would have?
No, then the son will start smoking because, because that's too much stress. Oh my God.
So it's a very it's very difficult to understand the psychology of people. I mean, I still fail to understand the psychology of a person who's in the first place smoking. I know there's another person who is his mom trying to justify why is he smoking, and the poor woman who is being affected the most is keeping quiet, not able to say anything. That's the plight of today modern woman who is even educated. It's so sad.
So very sad.
So very sad.
So very sad. Family support is one of the main things that you.
Very, yeah.
We talked about the
Yeah.
stress and the emotional component.
Yeah.
Uh,
So, abnormal semen parameters not only can cause infertility, it can cause abortions, it can cause birth defects, it can cause multiple problems.
the carry home birth rate.
Yeah.
I want you to educate the audience. There's a very slight nuance over there because every pregnancy is not a successful delivery.
Absolutely. Carry home baby rate. At home, you carry a baby. So that is very different from just getting pregnant. Yeah. So, in fact, the abortion rates could be as high as 10 to 15%. So 10 to 15% pregnancies may get lost. Now, to you, it may seem such a big number, but a lot of pregnancies end up in abortion, especially in the first trimester, in case there is something wrong with the pregnancy. It's a nature's rule. The nature would never want an abnormal embryo to develop. So the nature aborts the pregnancy. Now, we've seen women who are, couples who are smoking. The abortion rates could be much higher. So, yes, of course, there is a difference between getting pregnant and then finally taking your baby back home.
And that is why in I think I've read somewhere that the environment where the embryo is being formed is extremely important, which means the women should be healthier at the time of conception to get a successful outcome.
Absolutely. That's why I said, in case you are not planning to get pregnant in your future, at least use this time to make sure that your body is healthy. You keep working on yourself so that when you finally make a decision of becoming pregnant, your BMI is in order, your sugars, your blood pressure, your every parameter is in place.
In place. So moving from the pregnancy and the part from 20 to 40, the most important thing that I get questions on is the menopausal period between around 45 to 55. What is the common menopausal age these days?
Okay, so here once again the menopause is not a definite thing, is not a fixed thing for every woman.